This is Tricia. Tricia has a condition called neuropathy of unknown origin. It's also called idiopathic neuropathy, which means that there's a neuropathy for which we don't know the cause. There's not diabetes or thyroid problems or any other condition. Tricia, what can you tell us about your neuropathy that you've had over the past few years?
It started out with my feet, just really, really bad pains in my feet. I worked 3 days a week, 12 hours a day. By the time I left, I felt like I wished somebody would push me out in a wheelchair. I couldn't walk, I was limping, holding on to stuff, had to stop to get, every so often to get out of the building. And normally I'd get home, and by the time I got out of my truck, it was horrible pain.
How about trying to sleep at night? What would your feet feel like when you were trying to sleep?
It felt like, actually, it's almost like I'd walked on rocks all day, and they were numb, they were tingly, sometimes it felt like somebody had poured hot water on them. There was just several different pains all in one. It was horrible agony.
So you were treated with multiple types of medicines that could help with this. Neurontin, also called gabapentin, Lyrica, Tegretol. And you had to go to pretty high doses of that. And what were the effects of that medicine?
I'm still in school, but when I first started school, it felt like I was on top of my game. I was getting straight A's. As it went on, I kind of felt like I was confused. I couldn't think. I would know something one minute, and the day I have the test, I couldn't tell you what we were even talking about. It makes your brain feel like it's just swimming around. It has no stopping point. You couldn't focus on anything. I couldn't take care of my kids. It was awful.
I remember you said that when you wanted to play with your kids, you knew that if you took those pills, you wouldn't be able to play with them.
Yeah, I actually had to schedule my medicine around to take care of my kids.
Okay, so 3 weeks ago, we did an operation for you for your nerve compressions, and we did the operation on your right foot, right here. Here's one incision here for the tarsal tunnel and the nerves that go to the bottom of the foot. We decompressed the nerve on the top. We did a decompression of the superficial peroneal nerve and the common peroneal nerve. So it's been 3 weeks since we've done this foot. And how does that foot feel?
It feels great, and I can't wait to get the other one done.
Okay, we have that scheduled for you in 2 days, I think.
Yes, we do, and can't wait, really, I can't wait.
So, let's look at your feet. We did surgery on this left foot. How does this left foot feel compared to the right? Question, how does the right foot feel compared to the left foot that hasn't had surgery yet? Tell me the comparison.
Well, this one is just what I just described to you still. It still hurts, it still aches, numb. Feel like I'm walking on rocks all day. And this one I have absolutely no pain other than a little bit of stiffness from the surgery on my ankle part.
Yeah, that should go away with time. You have a little bit of swelling, but not much after 3 weeks, and that'll go away.
Yeah.
Okay, well, is there anything else you'd like to say before we turn off?
I just say if you have anything that's remotely close to what I have, you need to get to the doctor and ask them about it. See if you can get it, because I'm telling you, if you keep on trucking this way, you'll be miserable. You need to look into it a little further.
Thank you very much.